Hello, I'm Dr. Sanjay Gupta. Today, we're going to talk about something fundamental to our existence: sleep. We often think of sleep as a passive state, a simple period of rest where our bodies and minds shut down. However, the reality is far more complex and fascinating. Sleep is an active, highly organized process that is absolutely essential for our survival and well-being. It is the foundation upon which our physical health is built. It is the foundation upon which our mental clarity is built. It is the foundation upon which our emotional stability is built. Without adequate quality sleep, the very pillars of our health begin to crumble. It is not a luxury we can choose to indulge in. It is a biological necessity, as critical as the air we breathe or the food we eat. So, what exactly happens when we close our eyes at night? Our brains get to work on a series of vital tasks. During sleep, your brain consolidates memories, processing the information you gathered throughout the day. This helps you learn new things and retain important information. Think of it as a librarian, carefully organizing the day's books onto the proper shelves. At the same time, your body is engaged in critical repair and restoration. Cells regenerate, tissues are repaired, muscles grow. Your immune system also gets a significant boost. Unfortunately, for millions of people, this essential process is disrupted. This is where sleep disorders come in. A sleep disorder is a condition that consistently prevents you from getting restful sleep. As a result, these disorders can cause daytime sleepiness and interfere with your ability to function properly during the day. They can affect every aspect of your life, from your performance at work or school to your personal relationships and overall safety. Understanding these conditions is the first step toward reclaiming your health. In this discussion, we will explore three major sleep disorders that impact countless lives: insomnia, hypersomnia, narcolepsy. Each presents unique challenges, but with knowledge and the right approach, they can be managed effectively. Let's begin by defining what insomnia truly is. Many people think insomnia is simply the inability to fall asleep. While that is a part of it, the definition is much broader. Insomnia is a common sleep disorder characterized by persistent difficulty with sleep initiation, sleep duration, sleep consolidation, sleep quality. This occurs despite having adequate opportunity and circumstances for sleep. It is not just about having one or two bad nights after a stressful day. It is a consistent problem that leads to significant distress or impairment in your daily life. It is the feeling of being tired but wired. Your body craves rest, but your mind refuses to switch off, leaving you frustrated and exhausted. Insomnia is typically categorized into two main types. Now, we shift our focus from the struggle to get enough sleep to the struggle with too much sleep. This brings us to hypersomnia, a condition that can be just as debilitating as insomnia. Hypersomnia is characterized by excessive daytime sleepiness. Within the family of primary hypersomnias, narcolepsy stands out as a unique and complex neurological disorder. It is not simply about being very tired. It is a chronic condition that disrupts the brain's ability to manage its normal sleep-wake cycles. The boundaries between being awake and being asleep become blurred and fragile. This results in the hallmark symptom of overwhelming and severe daytime sleepiness, often punctuated by sudden, uncontrollable sleep attacks. These episodes can occur at any time, during any activity, whether the person is in a boring meeting or in the middle of a conversation. If you suspect you have insomnia, seeking a formal diagnosis is a crucial step toward finding relief. The journey typically begins with a visit to your primary care physician. Your doctor will start by taking a detailed medical history to understand your symptoms and rule out any other potential causes. Definitive testing occurs in a sleep laboratory. First, an overnight polysomnogram, the PSG, then the multiple sleep latency test, the MSLT, the next day. The PSG rules out other sleep disorders, especially obstructive sleep apnea. The PSG monitors brain waves, Managing hypersomnia and narcolepsy involves a multifaceted approach aimed at controlling symptoms, improving safety and quality of life, and helping people function better day to day. Treatment toolkit, medication, scheduled naps, behavioral strategies, workplace accommodations. When one person in a household has insomnia, the entire family can be affected. The frustration and anxiety of the person struggling to sleep can create a tense atmosphere in the home. Loved ones often feel helpless, unsure of how to offer support without making things worse. The key for family members is to approach the situation with empathy. Supporting a loved one with hypersomnia or narcolepsy presents a different set of challenges. These conditions are often invisible and widely misunderstood, leading others to misinterpret the overwhelming sleepiness as laziness or a lack of interest. Become an advocate and educator. Learn everything you can about the specific diagnosis. For individuals with significant sleep disorders, success and safety often depend on adapting their external environments. This is particularly true in structured settings like school and the workplace. Open communication with teachers. Section 8. Building a sleep-healthy lifestyle. Routines, diet, and safety. Beyond specific treatments and accommodations, building a lifestyle that supports healthy sleep is a powerful strategy for everyone, regardless of their specific diagnosis. Consistency is king. Establishing a regular daily routine helps to stabilize your circadian rhythm, your body's internal 24-hour clock. This means going to bed and waking up at roughly the same time every single day, even on weekends. This regularity trains your brain and body to anticipate sleep and wakefulness. What and when you eat and drink also plays a significant role. Avoid heavy meals, rich meals, spicy meals within a few hours of bedtime, as they can cause indigestion or heartburn that disrupts sleep. On the other hand, going to bed too hungry can also keep you awake. Finally, always have a plan for urgent situations. It is important for individuals and their families to know the crisis signs that require immediate medical attention. For someone with narcolepsy, this could be an increase in severe cataplexy attacks that pose a safety risk. For anyone with a sleep disorder, a significant worsening of depression or the emergence of suicidal thoughts requires urgent care. Have the contact information for your doctor. As we conclude our comprehensive journey through the world of sleep disorders, it is essential to return to our central, unwavering message. Sleep is not a negotiable luxury, but a fundamental pillar of your health. It stands shoulder to shoulder with nutrition. One of the most hopeful messages we can share is that for the vast majority of people suffering from these sleep disorders, effective treatments are available. You do not have to resign yourself to a lifetime of exhausting days and restless nights. The field of sleep medicine has made incredible strides, and there is a robust and growing arsenal of therapies that can significantly improve your symptoms and restore your quality of life. As you move forward on your journey to better sleep, it is crucial to arm yourself with information from reliable and trustworthy sources. The internet is filled with misinformation and quick-fix promises. The first and most important resource is always your own medical team, your primary care physician. Remember that this journey is a marathon, not a sprint. There will be good days and bad days, progress and setbacks. Be patient and compassionate with yourself throughout the process. I want to leave you with a final, heartfelt note of encouragement. Your struggle is real, but so is the possibility of recovery and a better quality of life. By watching this, you have already taken a courageous and important step toward understanding your sleep and taking control of your health. Continue to be your own best advocate, ask questions, seek help, and do not give up. A future with restful nights and energetic days is not just a distant dream. For millions, it has become a reality through proper diagnosis and care. It can be your reality too. Thank you for joining me. Here's to your health and to a good night's sleep.